Benefits of Clinical Decision Support Systems, CDSS, in clinical practice. Clinical Decision Support Systems, CDSS, have become an essential tool in modern healthcare, offering a range of benefits that enhance clinical practice. By providing real-time, data-driven insights and recommendations, CDSS help healthcare professionals make informed decisions, improve patient outcomes, and reduce the likelihood of errors. Below are the key benefits of CDSS in clinical practice. 1. Improving diagnostic accuracy and reducing errors. Accurate and timely diagnoses. CDSS assists clinicians in making more accurate diagnoses by analyzing patient data, such as symptoms, lab results, and medical history, and comparing it to large clinical databases. By doing so, the system can highlight potential diagnoses, offering suggestions that the clinician may have overlooked. Example: a CDSS might suggest that a patient with chest pain is at risk for a heart attack based on a combination of risk factors such as age, blood pressure, and family history, leading to faster diagnostic intervention. Reducing diagnostic errors. By offering clinicians a second opinion based on clinical evidence, CDSS helps minimize human errors, such as misdiagnosis or failure to identify rare conditions. It can also help avoid cognitive biases that might influence decision-making, improving diagnostic precision. Example: a CDSS could flag inconsistent lab results that suggest a misdiagnosis or offer differential diagnoses to ensure the clinician doesn't miss a potential condition. Early detection. CDSS can identify early signs of medical conditions that might not be immediately apparent to the clinician, enabling earlier intervention and improved outcomes. Example: the system might identify subtle abnormalities in a patient's lab results, e.g., changes in kidney function markers, that suggest early-stage kidney disease, prompting early intervention and reducing complications. 2. Enhancing treatment decision-making and patient safety. Personalized treatment plans. CDSS uses patient-specific data such as medical history, genetics, allergies, and other relevant factors to suggest personalized treatment plans. This can lead to more effective and tailored treatments that suit individual patient needs. Example: a CDSS integrated with genomic data could suggest a specific chemotherapy regimen for a cancer patient based on their genetic profile, leading to better treatment, outcomes, and fewer side effects. Preventing medication errors. One of the most important benefits of CDSS is its ability to reduce medication-related errors. CDSS can check for drug interactions, allergies, or inappropriate dosages based on a patient's medical history and current prescriptions. Example: a CDSS might issue a warning when a physician prescribes a medication that interacts with another drug the patient is already taking, helping to avoid harmful side effects. Monitoring treatment effectiveness. CDSS can track patient progress and provide ongoing recommendations for adjusting treatments as needed. This ensures that healthcare professionals can respond to changes in the patient's condition and optimize care. Example: if a patient's condition improves or deteriorates, the CDSS might suggest modifications to the treatment regimen based on the latest data. Reducing adverse events. By offering real-time alerts, CDSS reduces the likelihood of adverse events, such as complications from surgery, infections, or other medical conditions. These alerts are often triggered by changes in lab results, vital signs, or other indicators that clinicians may overlook. Example: a system might alert a clinician when a patient's blood pressure becomes dangerously high, preventing a stroke or heart attack. 3. Supporting evidence-based practice and clinical guidelines. Adherence. Evidence-based recommendations. CDSS integrates the latest clinical guidelines and evidence-based research into the decision-making process, ensuring that clinicians follow the most effective practices. This helps to standardize care across different providers and settings, improving the consistency and quality of care. Example: a CDSS might reference up-to-date clinical guidelines for the management of diabetes and suggest appropriate interventions based on the patient's specific characteristics, e.g., age, comorbidities, or response to past treatments. Clinical guidelines. Adherence. One of the main challenges in healthcare is ensuring that clinicians adhere to established clinical guidelines. CDSS helps with this by providing automatic reminders and suggestions based on best practice protocols, ensuring that the latest standards of care are followed. Example: a CDSS might remind a clinician to order a cancer screening test for a patient who meets the guidelines for early detection, ensuring compliance with screening protocols. Consistency. Across healthcare teams, CDSS helps ensure that all members of a healthcare team, including physicians, nurses, and specialists, are aligned in their treatment approach. This uniformity is critical for coordinated care, especially for patients with complex or chronic conditions. Example: for a patient with heart disease, CDSS ensures that the cardiologist, primary care physician, and nurse are all aware of the latest treatment plan and diagnostic tests, promoting better communication and reducing discrepancies in care. Support for decision-making in complex cases. In complex or rare cases, CDSS can provide clinicians with evidence-based information to support their decision-making. This is especially useful in situations where multiple treatment options are available, or when a patient's condition is unusual or hard to diagnose.
Example: a CDSS might offer treatment recommendations based on data from a similar case in clinical research, which can be especially useful for less common conditions or rare complications. Implementing CDSS in healthcare organizations. Implementing clinical decision support systems, CDSS, in healthcare organizations requires careful planning, design, deployment, and ongoing support. It also requires addressing various challenges, including technical, organizational, and cultural barriers. The following sections outline the steps for successful CDSS implementation and strategies for overcoming these challenges. First steps for implementing CDSS: planning, design, and deployment planning. Needs assessment. The first step in implementing a CDSS is conducting a needs assessment to identify the goals, objectives, and specific needs of the organization. This includes understanding the current clinical workflows, identifying areas where decision support can be beneficial, and determining the types of data and systems that will be involved, e.g., EHR, laboratory systems, imaging. Stakeholder engagement. Involve key stakeholders such as clinicians, IT staff, hospital leadership, and clinical guideline experts early in the planning process. Their input is crucial for ensuring the system addresses real-world needs and is compatible with existing workflows. Resource allocation. Allocate sufficient resources, including budget, personnel, and time, for the implementation process. This includes both financial resources for software acquisition and ongoing maintenance, and human resources for training, testing, and evaluation. Design, system design and customization. Based on the needs assessment, design a CDSS that aligns with the organization's workflows and clinical practices. This involves selecting the appropriate type of CDSS, knowledge-based, non-knowledge-based, or a combination, and customizing it to integrate with existing healthcare IT infrastructure, such as EHR and laboratory information systems. Clinical guidelines. Integration. Ensure that clinical guidelines and evidence-based protocols are incorporated into the system's algorithms. The system should be designed to deliver decision support that reflects the most current medical evidence and clinical best practices. User interface design. Design an intuitive, user-friendly interface that minimizes disruption to clinicians' workflows. The CDSS should provide recommendations or alerts in a non-intrusive way that allows healthcare professionals to focus on patient care while also benefiting from the system's insights. Deployment. System testing. Before full deployment, conduct pilot testing in a controlled environment to identify any technical issues, validate the system's accuracy, and ensure the system performs as expected. This testing phase allows for adjustments and improvements based on user feedback. Full-scale implementation. Once the system has been thoroughly tested, deploy it across the organization. Ensure that all relevant departments, e.g., clinical, IT, pharmacy, are involved and ready for integration. Monitoring and evaluation. After deployment, continuously monitor the performance of the CDSS. Evaluate its impact on clinical outcomes, workflow efficiency, and user satisfaction. Make adjustments as needed based on feedback from healthcare professionals and performance data. 2. Overcoming challenges in CDSS. Adoption. Technical, organizational, and cultural barriers. Technical barriers. System integration. One of the biggest challenges in CDSS implementation is ensuring that the system integrates seamlessly with existing healthcare IT infrastructure, including EHRs, lab systems, and radiology systems. Incompatibility between systems can hinder the flow of data and prevent the CDSS from functioning as intended. Solution. Prioritize interoperability and choose systems that support common data standards, e.g., HL7 FHIR, to ensure smooth data exchange across platforms. Data quality and availability. CDSS relies heavily on accurate and complete data from multiple sources, such as patient records, lab results, and imaging data. Inaccurate or incomplete data can lead to incorrect recommendations and compromised patient care. Solution. Ensure that data quality standards are in place, and implement regular data audits and cleansing procedures to maintain the integrity of patient information. Technology infrastructure. CDSS implementation requires adequate IT infrastructure to handle the increased data processing and storage needs. If the healthcare organization's IT infrastructure is outdated or underpowered, the system may experience slowdowns or crashes. Solution. Invest in upgrading the IT infrastructure to ensure that it can support the demands of CDSS and any additional systems it may need to integrate with. Organizational barriers, cost and resource allocation. The upfront cost of purchasing, customizing, and implementing a CDSS can be significant. Some healthcare organizations may face budgetary constraints that limit their ability to invest in this technology. Solution. Seek funding opportunities, such as grants, and demonstrate the long-term benefits of CDSS, e.g., reduced errors, improved patient outcomes, and cost savings, to secure financial support. Workflow disruption. Implementing a new system can disrupt existing workflows, leading to initial resistance from healthcare professionals who are accustomed to their current methods. This can delay adoption and reduce the effectiveness of the CDSS. Solution. Involve healthcare professionals in the design and testing phases to ensure the system integrates well with their workflows. Providing clear communication and setting realistic expectations about the benefits of CDSS can help reduce resistance. Maintenance and support. Continuous maintenance, system updates, and troubleshooting are necessary to ensure the CDSS remains functional and up to date with the latest clinical guidelines and technology advancements. Solution. Develop a plan for ongoing maintenance and assign responsibility to a dedicated team to ensure the system's performance remains optimal over time. Cultural barriers. Clinician resistance to change. Healthcare professionals may be resistant to adopting new technologies, especially if they are unfamiliar with CDSS or feel it threatens their autonomy in decision-making. Solution. Foster a culture of collaboration between IT, management, and clinicians. Engage clinicians early in the process, offer demonstrations, and emphasize the ways in which CDSS will enhance, rather than replace, their decision-making. Trust in the system. Clinicians may be hesitant to trust the recommendations provided by CDSS, especially if the system suggests alternatives that differ from their clinical experience or judgment. Solution. Ensure that the CDSS is evidence-based, integrates with clinical guidelines, and provides transparency in its reasoning. Offer training on how the system works and emphasize its role as a supportive tool rather than a replacement for professional judgment. Third, training healthcare professionals to use CDSS effectively. Comprehensive training programs. Initial training. Provide comprehensive training for healthcare professionals to familiarize them with the system's features, functions, and workflows. Training should include both clinical and technical aspects, ensuring users understand how to access decision support and interpret recommendations. Training modalities. Use a variety of training methods, including in-person sessions, online tutorials, and user manuals. Hands-on, interactive training is often the most effective for clinicians to build confidence in using the system. Ongoing education and support. Refresher courses. As CDSS evolves and updates are implemented, offer periodic refresher courses to ensure that healthcare professionals are up to date with any changes or new features. User support systems. Provide a dedicated support team to assist clinicians with any issues they encounter when using the CDSS. This ensures that problems are addressed quickly and minimizes downtime. Encouraging feedback and continuous improvement. User feedback. Create channels for healthcare professionals to provide feedback on their experience with the CDSS. Regularly collect input on system performance, usability, and usefulness to identify areas for improvement. Continuous improvement. Use the feedback to refine the system and address any issues that may arise during clinical practice. Regular updates to the system will ensure it continues to meet the needs of the organization and healthcare professionals. Types of clinical decision. Support alerts. Clinical decision support systems, CDSS, use various types of alerts to enhance clinical decision-making and improve patient safety. These alerts help clinicians identify potential issues before they result in harm and ensure that they are following best practices in patient care. Below are the main types of CDSS alerts commonly used in healthcare settings. 1. Alerts for drug-drug interactions and allergies. Drug-drug interactions. These alerts are triggered when a clinician attempts to prescribe medications that may interact with other drugs the patient is currently taking. Drug interactions can cause adverse effects, reduce the efficacy of medications, or lead to harmful side effects. Example: if a clinician attempts to prescribe a blood thinner like warfarin to a patient already taking an antibiotic like ciprofloxacin, which can affect the metabolism of warfarin, the CDSS will issue an alert warning of the potential interaction and suggest alternatives or adjustments to dosages. Allergy alerts. CDSS alerts healthcare providers to potential allergic reactions based on a patient's known allergies. These alerts help prevent prescribing drugs, contrast agents, or other substances to which the patient is allergic. Example: if a patient's record shows an allergy to penicillin, the CDSS will alert the prescribing physician if a penicillin-based drug is recommended, allowing them to choose a safer alternative. Polypharmacy. Alerts. These alerts are triggered when a patient is prescribed multiple medications that could increase the risk of negative health outcomes due to their combined effects. Example: if a patient is on multiple medications that could contribute to kidney toxicity or excessive sedation, the system will alert the clinician to assess the appropriateness of the prescribed combination. 2. Clinical reminders for preventive care, e.g., immunizations, screenings. Preventive care. Reminders. These alerts help healthcare providers keep track of necessary preventive measures based on clinical guidelines and individual patient risk factors. They ensure that patients receive appropriate screenings, vaccinations, and other preventive interventions at the right time. Example: a CDSS might issue an alert when a patient is due for a mammogram, colon cancer screening, or annual flu vaccination, ensuring that preventive care is provided in a timely manner. Immunization. Alerts. These reminders are crucial for ensuring that patients receive vaccinations based on their age, health history, and exposure risks. The CDSS will alert clinicians if a patient is overdue for a vaccine, such as the flu shot or hepatitis B vaccine. Example: a pediatrician system might remind them to administer the measles, mumps, rubella, MMR vaccine to a child at their 12-month checkup, ensuring adherence to vaccination schedules. Chronic disease management. Alerts for managing chronic conditions, such as diabetes or hypertension, ensure that patients receive the appropriate screenings and interventions, such as regular blood glucose monitoring or blood pressure checks. Example: a CDSS might remind a clinician to check a diabetic patient's HbA1c levels at regular intervals to monitor long-term blood sugar control and prevent complications. 3. Real-time diagnostic alerts and decision support. Prompts. Diagnostic alerts. These alerts are triggered when a patient's clinical data, e.g., lab results, vital signs, suggests a potential condition or abnormality. They help clinicians make timely decisions based on the latest available information. Example: if a patient's blood pressure is critically high or low, the CDSS can issue an alert recommending immediate intervention or further diagnostic tests to rule out serious conditions like hypertensive crisis or shock. Sepsis alerts. CDSS can analyze patient data, such as temperature, heart rate, and lab results, to detect early signs of sepsis, a life-threatening infection response. If the system detects suspicious patterns, it will issue an alert, prompting clinicians to take appropriate actions. Example: a CDSS might alert a physician when a patient's lab results show elevated white blood cell count and declining oxygen saturation, suggesting sepsis and prompting immediate investigation and treatment. Real-time decision support prompts. These prompts are designed to help clinicians make decisions during the patient care process. For example, a prompt may suggest additional tests, indicate the need for a referral to a specialist, or recommend specific interventions based on clinical guidelines and patient data. Example: a CDSS could suggest a chest X-ray for a patient with a persistent cough and abnormal lung auscultation sounds based on the possibility of pneumonia. Critical lab result. Alerts. These alerts notify clinicians about critical lab results that require immediate attention. They help ensure that vital test results, e.g., potassium levels, creatinine, are addressed quickly to prevent severe patient outcomes. Example: if a patient's potassium level becomes dangerously elevated, the CDSS will issue an alert, prompting the clinician to take immediate action to address the electrolyte imbalance and prevent cardiac arrhythmias. Clinical pathway alerts. These alerts are designed to ensure that clinicians follow the appropriate clinical pathways for treating specific conditions. They help ensure consistency in care and adherence to established clinical guidelines. Example: a CDSS might prompt a clinician to follow a stroke protocol when a patient presents with symptoms suggestive of a stroke, including ordering appropriate imaging studies and initiating thrombolytic therapy if indicated.